Good afternoon, everyone. Thank you for joining us. My name is Aida, and I will be your host for today. This session is hosted by three awesome teams, including GYBO Robotics Network, IEEE Women in Engineering, and Veebar Tech. GYBO Robotics Network is the only Canadian organization platform dedicated to robotics professionals and robotics industry. IEEE Women in Engineering in Toronto is a local affinity group of IEEE Women in Engineering Committee which gathers information regarding the status of women and initiatives for, by, and on behalf of women in engineering and science. And Veebar Tech is a Canadian startup company which focuses on bringing solutions for seniors with hearing loss and dementia. Welcome to Flatten the Mental Health Curve event. We are happy to announce that we are partnering with Adler University as well as IEEE Toronto section to organize this event, which will be focusing on mental health challenges that aging adults have been facing during this pandemic. This presentation is going to be 40 to 45 minutes long, and we're going to spend the rest of our time answering your questions. So if you have any questions, you can post them on the comments section, and we will go over them at the end. Our speaker today is Daniel Asadullahi. Daniel is a fourth year clinical psychology student in Adler University, Vancouver's PSYD program. As a part of his clinical psychological education, Daniel has completed 4-year-long practicums in the areas of mental health and psychological service delivery. He has also published work in BC Psychologist, the peer-reviewed Journal of the British Columbia Psychological Association, and is also a member of the International Honor Society in Psychology. Thank you for joining us, Daniel. We're so happy to have you here. So the screen is yours. You can start sharing your screen and presentation whenever you're ready.
Screen right now, is everything visible?
Yeah, everything's perfect.
Okay, great. Okay. All right, well, thanks everybody for being here today. So we're going to be talking about, I think, a pretty important topic and something that I know that a large number of people are curious about and want to know more about. And that's COVID-19, the current COVID-19 pandemic and people's mental health. So I'm just going to begin with this introductory slide, kind of introducing the problem, which we're all familiar with. The COVID-19 pandemic has basically negatively impacted people's mental health, especially that of older adults. And this is due to the isolation that's caused by physical distancing rules, the routine disruption that again is due to kind of the disruption of the normal routine of life, the fact that we can't necessarily do all the activities that we enjoy doing and normally do. And it's due to the inability to adapt with the change in the environment. So obviously, again, there have been new health rules introduced. We're asked to physically distance ourselves from one another and our loved ones and so on. And so that can cause stress for people. It can be difficult to cope with this significant change. And so we might see people's mental health suffer as a result of that. And of course, COVID-19's negative effect on mental health can also come from the stress and anxiety caused by the danger of the virus itself. Of course, we know from what our health officials have told us that COVID-19 is a serious condition that can affect anybody. It can infect anybody, and of course, we would all. It would make sense if we're all, to some extent, stressed and anxious about that, because it is a dangerous situation. And that kind of stress and anxiety can, of course, have a negative impact on people's mental health. So two main topics of this presentation are going to be difficulties adjusting to the current situation. I'm going to go through a number of these difficulties, potential difficulties that people might face. And then, and of course, while I'm doing so, I will also be providing some useful psychological tips and advice regarding how we can better cope with these difficulties. The other main topic of this presentation is going to be mental health questions to ask our loved ones and behaviors that we should check for on the part of our loved ones. So these are essentially intended to help us, these are questions and behaviors that we can look for that are intended to help us gain a better understanding of our our loved ones and senior relatives' mental health and psychological functioning. And in case there is something, if these questions indicate that there is something wrong, then perhaps we can take steps accordingly to address any psychological difficulties. Okay. So difficulties adjusting to the current situation, there could be many of them. It could include things like individuals feeling stressed and anxious for the reasons that I've already discussed. There are ways that we can actually try to deal with this, help individuals better deal with this stress and anxiety. And one of the things we can do is to engage in healthy communication. So that means being honest with our loved ones and stating that, and telling them that we don't exactly know when the current restrictions will be lifted, the current health-related restrictions will be lifted. However, scientists around the globe, including in Ontario, are working on creating treatments for the COVID-19 virus. Also, people everywhere are practicing physical distancing and proper hand washing techniques, and the combination of all of these efforts is going to help make the pandemic last a shorter time than it otherwise would. So kind of communicating these kinds of facts to our loved ones and relatives might be a good way to begin to relieve their stress and anxiety. Other things we can do is to help them kind of come up with coping self-statements or helpful self-statements. For example, things like, yes, it's difficult being isolated and lonely, but this situation will eventually get better, or is likely to eventually get better. Another one is another coping self-statement that we can have individuals, we can help individuals come up with is, things like, I can focus my attention on hobbies and other interesting tasks to better cope with the situation and stay in touch with family and friends via phone and social media. So again, kind of these are self-statements or sentences that help empower people, help them give them a better sense of psychological control and perhaps reduce their stress. Other things we can do to reduce feelings of stress and anxiety on the part of our loved ones is to help them understand that we are not entirely powerless in this current situation. We can, for example, closely follow the recommendations and suggestions of the public health authorities. We can practice physical distancing and regular hand washing and all the other safety measures that we know about. We can do our best to eat a healthy diet, exercise regularly, and sleep a good amount so that and of course we can maintain our physical health. And we can try to maintain social contact via phone and social media. Also, we can devote more attention to our hobbies, our pastimes, and other enjoyable activities that we can safely do. We can meditate, pray, and get more in touch with our spiritual side. We can support, encourage, and give hope to one another. We can do our best to make sure that we are not too anxious about things. Yes, the current situation is potentially dangerous, but if we're doing our best to follow health and safety guidelines, we don't need to constantly be on edge or constantly be anxious. Also, we can cultivate an optimistic mindset and do our part to defeat this pandemic. And that could involve educating ourselves and others about the health guidelines provided by public health authorities, as well as consistently following these health rules and health guidelines. Okay. Other difficulties that could arise in the current situation include things like individuals wanting to continue their active normal life or expecting routine behavior from others despite the current situation. So these are folks who want to basically keep living as before, and because they're not, maybe they've assessed the risk for themselves and they think that they're not going to worry about the possibility of infection and so on, and so they just want to keep living their normal life. And that can be difficult because, of course, there are these health rules in place, these new regulations in place, and to kind of try to go against those or try to disobey those might result in kind of difficulties or problems for not only the individuals doing so, but also the larger society. And so what are some ways that we can help people adjust better to the current situation and the rules and regulations, the new rules and regulations it brings? Well, we can begin by validating our loved one's frustration. You can say that, it is difficult and unpleasant to be isolated. It's difficult and unpleasant to not be able to engage in our normal routine. We admit that it is a very difficult and unpleasant situation and frustrating situation. But we can go further than that and provide reminders that the current situation is likely to be temporary, because scientists are working on developing a COVID-19 vaccine, which can help life return to normal. There's research going on, there's scientific work being done. It's possible that there will be a medical breakthrough, and I think there are already indications that things are changing in a positive direction in that regard, and so we might be able to vaccinate people, for example. And so the situation is likely to be temporary. We can also value our loved ones' cooperation with following the current rules and regulations. So we can kind of communicate to them that by following the health and safety guidelines and isolating themselves, they are doing something very important. They are contributing to ending the pandemic and helping to return life to its normal form for everyone. Another thing we can do in this regard is to remind people of our collective and shared moral responsibilities towards one another. Of course, we may personally feel okay with going out of isolation and engaging in our normal activities, but it's important from a moral and ethical perspective to remember that we could end up contracting the virus and spreading it to other people in the street, in our neighborhood, etc. And because we live in societies and communities, there is always other people's health to think about and consider when we are thinking about going out of isolation ourselves, right? Okay. Other difficulties that could arise during this pandemic that people might experience. Here's an example of that here. My parents have become germophobic and obsessive with cleanness as a result of COVID-19. How can we help to gradually reduce their obsessiveness? And this is something that can occur for people, and it's a response to a difficult situation. It's understandable. We can begin by, again, validating and normalizing people's concerns. It's normal to be concerned about the danger of infection in the current situation, and the public health authorities have told us about the importance of following the health and safety rules, which include regular hand washing and cleaning surfaces regularly, things like that. So begin with validating and normalizing their concerns. We could go on to encourage our parents or relatives or loved ones to try to not overestimate the danger. Yes, it's helpful to be cautious and careful in the current situation, but it's good if we can try our best to stay within the public health guidelines and not exceed them, not kind of go overboard with those guidelines. For example, when you come home from the grocery store, wash your hands thoroughly once, and then when you come home from the grocery store, you wash your hands thoroughly once, and then you can consciously remind yourself that that is sufficient, that is enough. You followed the health rules. There is no need to go beyond this and wash your hands a second time. You can even place sticky notes on the bathroom mirror and in the kitchen or other places, reminding you to not go overboard with following the health guidelines and kind of stay within these guidelines. If your parents are experiencing significant, or our loved ones are experiencing significant psychological stress due to cleanliness concerns, and they aren't able to manage this stress well, it may be helpful to contact your family physician, who may be able to refer you to a mental health professional who can help you more with this issue. And that's a very important point. Okay, other difficulties that could arise, people, for example, this individual is saying that I am an essential worker, and regardless of the situation, I need to go to work. My grandparents are worried about me and suggest to me that I quit my job. How can I explain to them that I need this job and I will be okay? That's an understandable question given the circumstances. And we can start by acknowledging our relatives' concern for us and expressing our appreciation for their concern. And then again, being honest can be very helpful. You can say that you need your job for the income it provides. You can add that you are not alone in this, that there are many other people all around the world in the same position. And you can also add that when you're on the job, you follow all the health and safety measures suggested by the public health authorities. So you're doing your best to stay safe on the job. Okay. Another example of a concern that people might have in the current situation: I am worried that my older parents do not adapt back to normal life post-COVID, after COVID. How can I make them mentally prepared to accept normal life and social communications once the quarantine is over? Very good question. And one thing that we can do is to periodically remind our loved ones that the current situation is likely to be temporary. We can also periodically remind them that doctors and researchers all over the world are working on developing a COVID-19 vaccine, and that this vaccine is likely going to be produced. So again, kind of reminding them that the current situation is temporary. It can change. It can go back to normal, or it can go back to a form that's closer to normal. We can also ask our loved ones, what are some of the things they would like to do once the quarantine is over? Would they return to an old hobby, for example, fishing or hiking with friends? Would they have dinner parties again? Would they visit some of their friends in person again? This can help our loved ones stimulate our this can help stimulate our loved ones' thinking about a future without COVID-19 and what their role in that future might be. Again, kind of communicating to them that the current situation may very well change, and that it's a good idea to be thinking about what you would like to do in a post-COVID world, and whether you would like to go back to some of your old activities, for example. We can also provide our loved ones with reminders about the positive aspects of life before COVID-19. And so these could include things like, and we could do that by making such comments as, remember how fun those family picnics were? If your family was involved in that kind of activity before the pandemic. Or by saying things like, Zoom is great for communication, but I really miss talking to people in person. It's another example. Or, I would really like to get back to outdoor activities. Those were really fun, and they were also good for health. So again, kind of reminding them about the positive aspects of life before the pandemic. And that can help them kind of become more comfortable with the idea of returning to a normal life once the quarantine is over. Okay. And people, it's also possible that during this current situation, during this current pandemic, people could also experience technological difficulties. It's possible that loved ones of ours who are older may be uncomfortable using devices and technologies that they find unfamiliar, and that's understandable. In cases where an older family member is open to having you help them figure out a particular technology, like Zoom, like maybe a cell phone or other communications, and you feel you are able to help them with this, it would be beneficial and potentially rewarding for you to become involved with this. So it's a good idea to actually try to help them figure out how to use this particular technology. In cases where an older family member feels stressed by the idea of using a new technology and they are not as open to learning how to use the new technology, it may be okay to encourage them to communicate with you via more familiar and already established systems like telephone, cell phone, or email. That's okay too. Those are a couple of ways of approaching this issue. And now we get to another major topic in this presentation, which is mental health questions to ask our loved ones and behaviors to check for. So here I'm just going to be discussing some of the kinds of questions we can ask our loved ones and some of the kinds of behaviors we can look for in our loved ones that indicate whether there has been any negative mental change on their part, and which of course would require kind of additional steps to help resolve. So what we can do is ask our loved ones questions regarding their sleep. How much sleep are they getting? Any changes from before? And we would be sure to, I think it's a good idea to also record these, kind of jot these down for yourself when you're talking to them, just so you can have a sense of that information. You can choose to jot it down and then kind of compare across, compare it to the next time that you talk to them. You can also ask questions about mood. How are your loved ones usually feeling? Are they usually sad and down, or usually in a decent mood and able to do their daily tasks and activities? So mood is another important area to ask questions about. Also, their stress and anxiety levels. Do they feel really stressed, only a moderate amount, or a lot? Activity levels. Do they feel mentally capable of doing their daily tasks and activities? Are they doing their daily tasks and activities? Okay. And there are also, if you'll excuse me for 1 second. Yes, and there are also behaviors that we can look for in our loved ones that can help them, that can give us a sense of how they are doing in terms of their psychological functioning. So for example, if they show if our loved ones show a consistently sad tone of voice when you talk to them, like, you talk to them one time, you talk to them next week, you talk to them the week after that, and they consistently have a sad tone to their voice, that could be a worrying sign. If they consistently have a hunched over and sad posture when they talk to you, if you can see them through Zoom, for example, and they consistently have a hunched over and sad posture, that could be a negative, potentially negative sign. Or if they have agitated behaviors, like they look like they can't relax, or they look like they're under a lot of pressure or under a lot of stress, that's another behavior that could be worrying. Or they could have increased forgetfulness, and that could be another thing to be watchful for. Yes, and if you notice a family member showing worrying behaviors or signs, such as the things that we've been talking about, like for example, if they're reporting low mood, anxiety, hallucinations, delusions, and hallucinations, if I were to provide an explanation, hallucinations would be seeing things that aren't there, hearing things that aren't there. Or delusions might be kind of strange strange beliefs rather, that aren't really consistent with reality. Like they might, it might be some very strange belief about maybe somebody harassing them or bothering them, when you know that that is not the case, when it's possible to show that that's not the case, so we do have to make sure that these beliefs are actually of a delusional nature. They're not, there's no, it's not really the case that what they're saying is happening to them. So again, hallucinations or delusions are things to watch out for. Low mood, anxiety are things to watch out for, and increased forgetfulness. So if you notice any of these kinds of worrying behaviors or signs, it's important to encourage your loved ones to talk to their family physician, or for you to get in touch with a healthcare provider or with a family physician and let them know that this is the situation. If necessary, the family physician can refer your family member to a mental health professional, a clinical psychologist, a clinical counselor, or a psychiatrist, or a physical health professional like a neurologist, which is a doctor that specializes in the treatment and study of in the treatment rather of brain disorders. Your family physician would be the person who would be able to, again, refer your loved one to a mental health professional or a physical health professional for further checkups and exams if necessary. So yes, it's definitely important to ask these kinds of questions of your family members and to look for these kinds of behaviors and notice them if they're there. If you didn't get a chance to remember all the questions and all the behaviors that I've been talking about, that's okay. I will be providing you with these slides after the talk today, so you will be able to actually come back to these slides and read them at your own pace and in your own time. Okay. So this is actually also included within these slides are a number of different resources, mental health and physical health resources that I've included, and it's maybe 8 or 9 different resources relating to different areas like irritability and anger, some safety tips for dealing with COVID-19, how to strengthen your physical health during COVID-19, how to boost your immune system, a number of different mental health and physical health resources. There is also one included here about virtual therapy and mental health apps or applications that can be downloaded on our phones and devices, and these can be used to help us with our mental health goals and our relatives' mental health goals. So all these slides with the resources are included among the slides that will be given to you after the presentation. Okay, so I've actually reached the end of my slides. I'm now open to taking questions if there are any. I'd be happy to take questions.
Okay, thank you so much for your amazing presentation. They were really great tips that I was actually going to ask myself, but I got like a couple of more questions in the comments sections. Sure. So the first one is, how can we stop mental health services moving into virtual and remote working from becoming inaccessible for elders without technology?
So it seems like there's 2 parts to that question. Is that right? If I heard it correctly, there's like a part about mental health work going virtual.
Yeah. So what they're asking is that, like, how can they stop these services from moving into virtual and from becoming inaccessible for elders without the current technology used? I also posted it in your message section as well if you want to go over it.
Oh, sure. Yeah. Thank you. And so, yeah, I'm just trying to, okay. I'm having a bit of a difficult time finding the,
that's okay.
The chat section.
If you stop your share screening, I think
that would make sense, of course. Yeah, okay. Okay, so how can we stop mental health services moving into virtual and remote working from becoming inaccessible for elders without technology? Right. So unfortunately, that's a good question. And unfortunately, some mental health services may in fact just have to become virtual because of the situation that we're currently facing. It may be very difficult and unsafe to have non-virtual or kind of physically close mental health services like we used to have before the pandemic. It's a matter of safety and kind of health and safety concerns. And so some of these mental health services, unfortunately, are going to become virtual or have already become virtual. Now, it's possible that as we go forward, things change. Like, for example, we are currently going through these phases phases of reopening. And so reopening the economy, reopening society, and so on. And that means that mental health services could actually go in that direction as well. For now, though, it seems that at least some mental health services will continue to be delivered virtually for health and safety reasons. And yes, it's of course a concern if people can't, elders without technology can't access these services. That's why there is like the resources that I provided at the end of the presentation in those slides. They will be online resources that could be accessed by loved ones who do have access to, by loved ones of our relatives who do have access to technology. And then perhaps we can make, printouts and copies of those pages and provide physical copies and physical materials to our elders so that they can study it on their own time and use it for their mental health. That's one solution. Okay, hopefully I've answered that to a satisfactory extent. With regards to question 2, concerned about managing grief during this pandemic, specifically for older adults living alone. Yes, that's certainly an important concern. And I think there are, if you were to look into some of the resources that I provided, there could in fact be ways that you could reach counselors via phone, mental health professionals via phone, and they might be able to provide grief counseling for older individuals, which is obviously an important concern. I think you might be able to find that kind of counseling via phone. It's also important to kind of do certain things to help our elders with regards to grief. We can normalize their grief, kind of tell them that grieving is a normal process for all human beings. It's okay to grieve. It's okay to mourn the loss of a loved one. It's okay to feel sad about that, and that just letting them know that it's okay if they want to, if it takes them some time for the grieving process to continue. If it goes on for several weeks or several months after the person, the loved one has been lost, it's okay to grieve during that period. That's just a normal human response to a very difficult emotional event. So kind of normalizing grief for our loved ones is important, and encouraging them to grieve in the way that they want to grieve. Yeah, certainly seeking out online or on the phone counseling services that can be obtained in some cases free of charge, and people can provide grief counseling. I think the Ontario Mental Health Resources slide that I provided at the end of the presentation, that is a good resource to look into for mental health resources in this regard. Another question is how the mental well-being of individuals in high-stress jobs like high-growth tech is being impacted when companies aren't slowing down. Yeah, and so obviously now I'm not. It's not exactly clear from the way the question is worded what the person who's asking the question is asking, but it seems like they're concerned about the mental health well-being of individuals in high-stress jobs. So for sure, that's that's understandable. There is in fact. Some companies aren't slowing down. They are kind of, they're having their employees work from home, or they're getting their employees to do the work in other ways. And so you might find that it is in fact very stressful. And some of the things that I've been talking about in the presentation apply to everybody, not just older individuals. So things like making sure that we're taking care of ourselves, we're self-care basically, we're exercising regularly, we're getting enough sleep, we're eating nutritious foods, we're kind of attending to our hobbies, or spending time doing our hobbies and the things we enjoy doing, we're spending time with loved ones. All of these kinds of things can actually help reduce our stress levels and help us better deal with our job responsibilities and work responsibilities, which are there for some people. And yes, they can be stressful, but it's always possible to do things to kind of reduce our stress levels, to kind of better manage our stress levels, like the things I mentioned. Also, I should add that spirituality and religious activity and prayer and meditation and so on, all of these things can be helpful as well. These can really, if you are a religious person, or if you are a spiritual person, or if you just like to meditate and do that kind of a thing, these are all helpful things that you can do as part of your stress reduction kind of toolkit. Another question is, I live in Oakville, and the local senior groups are organizing phone trees and finding ways to reach out to seniors who don't have email, computers, etc. Yes, yeah, that sounds like, okay, so that's more like a comment about what's
Yeah,
the
that's, I think
particular.
that's just some general information.
Yes, yeah, and that's
Really,
really great. So yeah, finding ways to reach out to seniors who don't have email and computers, and I think that's really great. And I think that should be. I personally would certainly encourage people to do that kind of a thing. That sounds like a really good way to maintain social contact and social communication during this time. That's great. Another one is I'm concerned about a lack of social supports available for seniors. Any advice? And sure. So there's I can see that there, in some parts, in some places, it may be that there is a lack of social supports available for seniors. And yeah. I think that's why things like the from what I understand, the phone trees, that is a very good way of kind of of allowing seniors to maintain social contact and social connection during this time. So there are things to look for, resources online or and in other places that can allow people to connect with social groups and with even if it is via phone, even if it is via Zoom, it's still a kind of social connection. It's still a social contact. So it's possible to look for these different things. And of course, family members can play a big role here, regularly talking to our loved ones, calling them, chatting with them via social media or email or whatever. There's different ways to kind of maintain those social connections in the absence of actually physically getting close to people. Yeah, hopefully I've answered those some of those questions.
okay, great. Thank you so much. That was a very informative presentation. And well, thank you so much for joining us today. We really appreciate it. And as Daniel mentioned, he's going to send out all the slides, and I will forward them to you if you already registered through our Eventbrite page. Yeah, so I guess that's it. So thank you all for coming. Thank you for Daniel for taking the time. We've really enjoyed this session. Thank you so much.
Thank you.